Good morning and greetings from the World Health Organization. I'm Dr. Sowmya Swaminathan, the Chief Scientist at WHO. I want to first of all congratulate everyone who's been involved in this endeavor, and today you're celebrating the successful partnership of several years and the contribution of several people. As we all know, assistive technology enables and is in fact is a prerequisite for people with disabilities, older people, and people living with chronic conditions, particularly non-communicable diseases, in order for them to live healthy, productive, independent, and dignified lives, and by facilitating their participation in education, the labor market, and in social life. Access to assistive technology makes the disabled able and productive. However, we also know that persons with disabilities are met with a number of barriers to access even basic products, primarily due to cost and unavailability. WHO estimates that only 1 in 10 people in need have access to assistive products, owing to high costs, a lack of financing, or lack of availability, or a lack of awareness, and a lack of trained personnel. So, for example, 70 million people today need a wheelchair, but only 5 to 15% have access to one, and these would be mostly in high-income countries. Assistive products such as hearing aids, spectacles, rollators, and wheelchairs, these are all essential health products, and they are life-changing for the people concerned. In fact, the impact of assistive technologies and products goes far beyond the benefits to health and well-being to the individual users and their families. It has socio-economic benefits by reducing both direct health costs such as hospital admissions. It increases access. Wheelchairs, for example, definitely increase access to education, employment, social participation, and their use also reduces healthcare costs owing to a reduction in the risk of pressure sores, contractures, etc. To date, most research and development in the area of assistive products has focused specifically to high-income contexts, and there's an urgent need for research and innovation to be driven by the needs of diverse users and contexts around the globe who are really the majority of people. We need more affordable assistive devices to be available for everyone, everywhere. There is also a need for quality and safety standards that are appropriate for diverse settings, especially rural environments. Addressing the unmet need of assistive products is crucial to advance universal health coverage, the Sustainable Development Goals, as well as to implement the UN Convention on the Rights of Persons with Disabilities. Leaving no one behind means ensuring that people with disabilities, the older population, and those affected by chronic diseases are included in society and enabled to live a healthy, productive, and dignified life. To address this need, particularly the unmet need, in 2014, WHO established the Global Cooperation on Assistive Technology, GATE, to develop and coordinate a global initiative to support member states in realizing their obligations to the Convention on the Rights of Persons with Disabilities and towards increasing access to assistive technologies. In the last 5 years, in order to improve access, WHO has taken several actions. In 2016, WHO published the Priority Assistive Products List, modeled along the lines of the WHO Model List of Essential Medicines. WHO has organized so far 2 Global Researchers and Innovators Summit, one in 2017 and one in 2019, and has published a Global Assistive Technology Priority Research Agenda. This can help academics and innovators and other groups, entrepreneurs who want to pursue research and development in this field. Last year, the World Health Assembly adopted a resolution improving access to assistive technology for everyone, everywhere, as well as progressing towards universal health coverage, the 2030 Agenda for Sustainable Development, and realizing the Convention on the Rights of Persons with Disabilities. So there's a global movement and recognition that this is an important area that member states need to put more emphasis on. We also helped to shape the agenda of the 2018 Global Disability Summit that was co-hosted by the UK government in partnership with the International Disability Alliance and the government of Kenya. One of the key outcomes of that summit was the establishment of the Global Partnership for Assistive Technology, also known as AT-Scale, with NORAD, USAID, DFID, UNICEF, and others. So besides political engagement and resource mobilization, encouraging innovation and market shaping of priority assistive products is the focus of AT-Scale, and we hope very soon that India will become one of the partners of AT-Scale and set up a center that is dedicated to innovation in this area. Some of the upcoming products from WHO include a global report on assistive technology. This is due in 2021. A progress report on access to assistive technologies will be due from 2022 onwards, every 4 years. A one-stop assistive technology provision center within the ambit of the primary healthcare universal health coverage work within WHO. A training package for primary healthcare personnel on assistive technologies, coming up with a second list of priority assistive products, the APL2, as well as coming out with a document which will describe the specifications and standards for these priority assistive products. So quite a lot of work, and I should congratulate my colleague, Dr. Chapal Khasnabis, who's been driving this agenda forward in WHO headquarters. I'm delighted to see that the Department of Mechanical Engineering of IIT Madras, supported by the TTK Center for Rehabilitation Research and Device Development, the TTK Trust, the Wellcome Trust, UK, as well as the Phoenix Medical Systems Limited, have come together and worked collaboratively in order to develop this standing wheelchair, which is being launched today. I wish I was there today in person with you, but I have seen demonstrations as well as videos of how the standing wheelchair works, and I cannot even begin to imagine the kind of liberation and pleasure it's going to give to its prospective users, because it's really a game changer for people who are wheelchair bound. And so I really want to congratulate Dr. Sujata and her team, as well as the funders and partners who've come together to develop this. I wish you all the very best, and I also hope that we're going to see many more such innovations coming out of this center, which will benefit those who have differently abled and who need the help of such devices and products. Thank you very much for giving me this opportunity to speak to you remotely. Namaskar.